Hi everyone, this is Connor Downey, and you are listening to the Vitalis Podcast. Hello everyone, and welcome back to the Vitalis Podcast, where detox is just the beginning. Today we're talking about the phase that most people skip, but is by far the most important one. So you've cleared out the toxins, you've opened up the drainage pathways, you've mobilized the burden. Now it's time to rebuild, remineralize, and renourish your body so that you can thrive fully and live the healthiest, best life that you can. Now, as we kind of start jumping into this topic, I know this is kind of number 3 in the series. I think there's going to be a lot more to come on this, but this is really the next step in the process that I've gotten so many questions already about. The feedback's been incredible. So I want to thank you all for tuning in, taking time out of your day to listen into this. It means so much. So I am so grateful to have every single person that's tuning in, listening, and being able to offer I think a little bit of light in a little darkness that's circulating around in and around this space. I've noticed that there's a lot of noise, there's a lot of confusion, especially as you start trying to take charge of your life and start to live a healthier life, detox. I've noticed that there is a lot of information circulating. It's hard to sort through the noise. So I'm hoping that the information that I can share with you here from my knowledge and my experience and my research can ultimately help you guide through this. And like I said, be that light in the darkness and hopefully be a bridge. Like I said, I have a lot of experience in the acute and emergency medicine side of Western medicine. And I also have obviously years and years of experience in the integrative, alternative, and holistic health spaces. So I'm just like you. I'm not somebody that has, an MD behind my name and somebody that I think society has really put that burden on, that it's hard to have an opinion in this space. If you don't have an MD behind your name, it makes a lot of people feel like they have to outsource all of their health to someone else. And I've said it before, and I'll say it again, your health is far too important to outsource to anyone else. So do research, get tons of opinions, really dive into this. And my goal is to not make it so high level that anybody can't experience it and learn from it. So I'm hoping that the knowledge that I deliver to you here is something for absolutely anybody to be able to take on and retain and utilize and deliver it in a format that I hopefully can bring you some value on the whatever journey it is that you're going through. If there's certain things that you guys want to hear about, if you're struggling with things, please reach out to me, DM me on Instagram. I would greatly appreciate it. I love talking to every single one of you and offering some insights and some advice. I am so grateful to have every single person tuning into this. So if you guys are ready, let's get started. So phase 1 of the next step of this is, so how do we reintroduce everything into our body? How do we rebuild? How do we renourish? So phase 1 after the detox clears is now it's really time to start restoring balance to your gut, to your hormones, and replenishing a lot of those nutrients. So it's very easy to lose a lot of those. So as we start reintroducing all of these things, first step is we want to do it slowly. And I'll kind of go through this as we go through this episode, but it's very easy as you start to make a lot of changes, you start feeling really good, you start getting a lot more energy, and you start noticing, there's a lot of impact from our GI system on our neurotransmitters. So you start naturally feeling better. It's very easy to throw everything back in again. I don't recommend that. I recommend going very slow, being very controlled. Make sure that you're going through this entire process, start to finish, whether you're detoxing or you're in this next phase that we're going to talk about now. Monitor everything, record everything, write down how you're feeling, write down your experiences, your mood, your energy levels, your digestion, write all of it down and really track it and see how you respond, because that's going to be the most important factor in learning about your body. And as you continue this process and you continue to go through life, it's important that you learn, what does your body respond to? What does it not respond to? What does it feel well with? And ultimately, that's going to guide you. Some things, some foods, people are going to feel fine with. Others, people are not going to agree with. So listen to your body. Above all else, listen to your body, track everything, write it down. And as you continue in this space, we can really kind of start grasping a little bit more about what our body specifically responds to. Health is not a one-size-fits-all approach. Nothing in this is going to be. So we're going to give you a lot of tools. I'm going to give you a lot of insights, but ultimately you need to listen to your body and actively find out what it needs on a daily basis. Really, the next phase in this is that I want to talk about is choosing organic. Why is it important to choose organic, especially when we talk about something called the dirty dozen? When you hear the dirty dozen, you should think berries, apples, leafy greens. So really, what are going to be absorbing pesticides more than anything else? And this is why is this important? It's because pesticides like glyphosate and atrazine act as antibiotics, and they are basically destroying your gut's bacteria and disrupting your hormone function. We'll talk a lot about atrazine in this episode as well, which I think is important to touch on. We'll jump into it next, but there is certain things that are important to buy that are organic, and there's certain things that, in my opinion, there's a balance between. If you can buy all organic, absolutely go for it. Do you need to buy all organic? Not necessarily. I think that you can have an argument on either side. Ultimately, I will say if you're dealing with a lot of autoimmune issues, you're dealing with a lot of inflammation, a lot of flare-ups, you want to get your GI as healthy as possible, I would opt in for organic, especially if you're noticing that, your health is your number one priority. At minimum, the dirty dozen, your berries, your apples, your leafy greens, your fruits and veggies, basically, you should be making sure that like these ones that are very porous, that absorb a lot of these harmful chemicals, especially berries is a huge one. There's a lot of certain fruits and vegetables that have a very hard outer shell, like avocados and certain things like that, that don't absorb pesticides quite as much. So do more research into that, make an informed decision, obviously, about what you're purchasing on your visits to the grocery store. And ultimately, I think that's going to be one of the first phases. The reason this is so important is you've already started detoxing your body. You started getting a lot of these harmful chemicals out. If you've been listening to the last few episodes, we've talked about how to basically detoxify your life, when everything from limiting toxic exposure from our cookware to our cosmetics to the clothing that we wear, all the way down into the last episode, which is where we were talking about how do we actually detox, how do we chelate, how do we clean up our body using binders and certain things like that. So as you're going through this process, now is the time not to start to fall right back into the ease of what a lot of these companies, a lot of these farming industries have put into place for us to easily be exposed to these types of chemicals. So keep that in mind. Keep your health and how you feel at the forefront of your brain. What you don't want to do is start adding these things back in, then automatically re-toxifying your body that we just spent so much time trying to detoxify. As far as atrazine is concerned, I think, atrazine has started gaining a lot more popularity recently. People started talking about it a little bit more. Atrazine is the second most used herbicide in the US, and it's banned in several other countries, especially in Europe. It's actually found in about 63% of drinking water in the United States today. There are studies that link it directly to fertility issues in both men and women. Atrazine is very, very harmful. Now, there's research coming out of UC Berkeley by Dr. Tyrone Hayes that even showed that atrazine causes hermaphroditism in frogs at levels that are lower than what's even allowed in our water. So they're basically developing male and female sex characteristics, these frogs, and being exposed to far lower levels than what's even in US water sources. Robert F. Kennedy has spoken about this publicly as well, about the chemical exposure. Whether how you feel about him or not, it's definitely a real concern. We've really started seeing, based on what he's spoken about, and obviously what others have started concluding, is that atrazine, especially in fertility and developmental issues in children, there is a significant impact. So after detox, it is crucial to make sure that you're eating organic foods, that you're avoiding reintroducing these endocrine disruptors back into your life. And atrazine is a big one. So research atrazine, grab a little bit more information on it. I can tell you that there is significant research in and around California, especially when you look at being the leading state in pesticide use in the US, and also having a direct correlation to number of autism rates. So it is leading both of those. And as far as autism rates in California, 1 out of every 22 children are going to develop autism. So they have definitely some of the leading numbers in both pesticides and autism rates. So there's an interesting correlation there when we talk about how atrazine affects developing children, and especially when we talk about fertility and endocrine issues. So keep that in mind. It is something that you should definitely be considering and keeping out of your body as much as possible. So keep that at the forefront of your brains as you guys are going through this process. The next phase that's really important that I want to touch on is really the importance of clean meats. So clean meats, clean proteins directly correlates to clean hormones. So choosing grass-fed and grass-finished beef is really important. Just because something says that it's grass-fed does not mean that it is grass-finished. A lot of times these industries are able to take something and get it almost all the way grass-fed and then finish it with grains to basically fatten it up. And a lot of times, unlike grain-fed or grain-finished meat, these animals that are 100% grass-fed, grass-finished, never eat corn, soy, or glyphosate laden grains. They basically produce meat that is higher in omega-3s, CLA, vitamin A, and vitamin E, and antioxidants like glutathione. So grain-fed beef, on the other hand, is very pro-inflammatory. It has a very high inflammatory fat profile. It has a higher mycotoxin exposure, and it can disrupt your gut and your hormone balance, which is especially harmful post-detox. It's definitely harmful while you're going through detox too. I would limit it as much as possible when it comes to buying organic and eating grass-fed, grass-finished beef. You know, completely antibiotic-free beef and chicken, any of your meats like that. When we talk about fish as well, getting any kind of wild caught fish is going to be very important. You don't want to get something that's farm raised. The more that we talk about things that are directly in our meats or in our seafood, we're noticing that the more corners that are cut directly impact your health. They have a significant impact in our health. So it might not seem like it. Small corners here, farm raised versus wild caught, grain finished versus 100% grass fed, grass finished, some antibiotics in your meat if they're not 100% free range chickens. All of this makes a pretty significant impact in what is introduced into the meat and then what is introduced back into your bodies. And so you don't want a high inflammatory profile in the meat that you're consuming. You definitely don't want to deal with any of these antibiotic laden proteins that you're putting into your body either, because that is going to directly affect your gut microbiome. It is going to directly affect your weight gain, your endocrine levels. It is going to directly affect several different factors inside of our body, especially when you look at cortisol and some of these really other important inflammatory markers in our body as well. All of those start to shoot up, and we start noticing that our body becomes more and more toxic filled, and we have an inability to basically get that to a level that's maintainable where we're feeling healthy and we're functioning the best that we can on a consistent basis. So I really can recommend it when you go to the grocery store. If there's some things that you should look at, take pride in the meat that you're buying, take pride in the fruits and veggies that you're buying as well. Really make sure that you guys are getting, especially the Dirty Dozen, all organic there. Make sure that you're getting grass-fed, grass-finished beef, free range, no antibiotic given chicken, wild caught fish. All of these factors do apply into the toxins that leach into this meat and the seafood that we are now ingesting into our body and how it affects our body at a cellular level, on an endocrine level. So keep that in mind. These are easy traps to fall into, and they do make a significant impact, especially on the way that you feel. And when we start looking at correlation to individuals with autoimmune issues, and we start looking at issues with disease and cancer and all of the formation, we look at oxidative stress, we look at disruption of gut microbiome. This all ties back into what are we putting into our body, and there is a direct link to disease and our GI system. So keep that in mind. Now, the next thing I really want to dive into is oxalates. I don't know if people have heard about oxalates. I think it's very important to talk about oxalates. There's a lot of people that are on this vegetarian kick, vegan kick. If that's the life that you live, that's fantastic. I think a lot of people have gotten great benefits from varying different food and variations in diets, and everything from carnivore to paleo to vegan and vegetarian. I think the important thing is I'm going to kind of give a little bit of my opinion on it and talk about the importance of protein, for one, from a vitamin perspective and an iron perspective, and then also the oxalates. So touching on the oxalates first, watch your oxalate load after a detox. Things like raw spinach, leafy greens, beets, almonds, sweet potatoes. A lot of these foods are going to be high in oxalates, which can bind to minerals, and they can stress the kidneys and trigger inflammation in the body. So instead, at least out of the gate, opt into more low oxalate foods like squash, blueberries, carrots, cucumbers. Steam your greens, and then try and rebuild your flora first before introducing a lot of high oxalate foods into your diet. If you are going to be consuming oxalate foods, you're taking in spinach, sweet potatoes. I love sweet potatoes. It's important just to rotate around so that way you're not harming your body with these high oxalates, and they cause a lot of inflammation. They can cause a lot of soreness in your joints and your tendons. So just keep that in mind. I think I've noticed that as I have started to limit the amount of oxalates that I'm consuming in these specific foods, and I've started rotating them around, I feel better. I'm not as inflamed. My joints are better. So I think that does have an impact for a lot of people. Now, from a vegetarian vegan perspective on the nutrition side, protein is a very important thing, especially for mood. When we eventually talk into nutrition and we talk about mental health, there is a direct link between protein and mood disorders. A lot of people that aren't getting high enough levels of protein into their body are noticing increased levels of depression. So protein has a very high impact in that. It also has an important profile of B vitamins. When we look at red meats, we look at the importance of the vitamin profile that we can get from protein. It's very important for a lot of individuals. So if you are not getting high levels of meat in your diet, you're not getting enough protein in your diet, you're probably missing a lot of these, especially the suite of B vitamins that you're going to be getting. And there's a lot of these nutrients that come from these meats. I would opt in to let you know that the reason oxalates are so damaging as well is because they can deplete that B vitamin store in your body as well. So they start causing a little bit more harm. So if you're not having this B vitamin protection, you're limiting that. Your body's not getting enough of this. You start becoming more and more nutrient deficient. Your body starts scavenging other areas and essentially trying to restore these metabolic processes that it's losing by not getting the suite of B vitamins, especially when we talk about our recycling process, when we talk about anti-aging and reducing disease risk and the importance of the antioxidants that are in our body. There is a very direct role when we look at the suite of B vitamins and a lot of these other nutrients that come from meats. So the important thing is definitely getting a methylated set of B vitamins into your body. We'll talk about this more when we look at the MTHFR gene mutation. We talk about methylation in the body. We talk about folic acid. I think a lot of people are starting to hear a little bit more about this, but that is a very real thing. A significant amount of people are dealing with gene mutations that do not allow them to methylate B vitamins. Methylation is where we are basically taking a inactive form of a vitamin and converting it into the active form, specifically B vitamins. And so converting folic acid to methylfolate in that active form, a lot of people don't have the ability for. So if you're looking for any type of a B vitamin set, make sure that they're methylated, methylcobalamin, methylfolate. These are going to be the important vitamins to take on. I wouldn't go and take cyanocobalamin. I wouldn't be taking folic acid. I would specifically look at a methylated form of B9 and B12 if you're looking for those ones, and any other vitamins that you can get in that B vitamin suite that you can obviously opt in for. Methylated forms is going to be a better way to go, but oxalates can have a high impact on that as well. And then that directly is going to affect how you feel, how you perform. So make sure that you're getting plenty of B vitamins in. The best way to get it is through whole foods, especially red meats and things that are nutrient dense in that capacity. Especially protein is going to be very important for reducing muscle wasting and muscle loss, and primarily for our brain. Protein is very, very important for mood. When we start looking at other forms of metabolism, so fats or carbohydrates, that's really where we start looking more of like the protection over the muscle. But as far as maintaining an adequate level of nutrients and reducing malnutrition, protein has a pretty crucial role in that. So keep that in mind. And then FODMAPs. So FODMAPs, FODMAPs. So there's basically importance when it comes to food pairing, and we talk about smart gut nutrition. Now, as you start reintroducing more foods back into your body post-detox, it is important to go kind of just beyond eating and focus on how you're combining it as well. So this can reduce bloating, improve absorption. It can also help keep your gut lining healthy and calm so that we're not promoting inflammatory responses. So FODMAPs are fermentable sugars that can be difficult to digest, especially if your gut lining is still healing, which it definitely will be post-detox. And this can lead to the wrong kind of bacteria and lead to gas and bloating and irritation. So common foods that are high FODMAP foods, we're looking at things like garlic, onion, especially if they're raw, which I love garlic, I love onion. I just think that as you're going through this process post-detox, you need to be careful what you reintroduce into your body, and you need to monitor at a level that you can obviously track and keep an eye on. Apples, pears, watermelon can be high FODMAP foods, wheat, barley, rye, beans or lentils, and then dairy. So especially milk or soft cheese, kind of in that perspective. Low FODMAP foods like zucchini, carrots, spinach, squash. We look at blueberries, strawberries, bananas, rice, quinoa, firm cheese like cheddar or goat cheese. Goat cheese is great. And, if you look at like an A2 dairy if tolerated, things like that are going to be low FODMAP foods. So they're going to have lower inflammatory responses, lower irritation, lower bloating. So I definitely would opt in as you start reintroducing a lot of these foods. Don't throw everything, the whole kitchen sink, back into your diet all at once. Make sure that you're giving your body the opportunity to adjust and acclimate. And the best way to do that is starting with low FODMAP foods and then start introducing some of these other higher FODMAP foods or nightshades back into your diet. I think nightshades have a fantastic place in our body. We're finding more and more nightshades are great detoxifiers for the body, especially because they're going to hold a certain nicotine component in them as well. So they're going to open a lot of our detox processes. And there's a lot of really, really good cancer fighting benefits or anti-cancer promoting benefits of these foods, specifically the nightshade vegetables. So as you're reintroducing that, do it slow, do it controlled, monitor, track everything, track how you're feeling, track your response, your bloating, your bowel movements, your sleep cycle, your energy, everything should be tracked as you're reintroducing these foods back in post-detox. And then food combination principles is kind of the next important topic in that as well. So when it comes to what you're combining, that's going to support digestion. So some foods pair better than others. The goal is to reduce fermentation and digestive stress. Those are the two factors as we start reintroducing these foods we want to limit as much as possible, especially as our enzyme levels normalize after a cleanse. So combinations that you really should avoid is meat and dairy mixed together. It's difficult for the stomach to process together. So when you look at cheeseburgers, cream sauces on meat, those should be avoided, especially just off the bat. I would really be careful. I would start by keeping those separate, reintroducing food slowly, starting with low FODMAP foods and things that are going to be very good for your digestive system, and then start looking at pairing these back together and seeing how you feel. Other ones are going to be things like fruit and protein. So fruits digest very quickly, proteins take longer, which can lead to fermentation. So skip basically the steak and pineapple combo and keep those two separate. Keep a few hours in between foods like that. So if you're trying to, essentially you're like, hey, I want to have pineapple tonight. There's a lot of people that track their diet, track their macros. That's something that they want to make sure that they keep inside of their dietary profile. That's completely fine. I would recommend, obviously, from a digestive perspective and keeping the inflammatory response low, keeping the digestive stress and the fermentation low, I would essentially opt into having one or the other and then having at least a 2-hour gap in between so that your body has time to digest and those don't just sit there and ferment together. The other one is grains and acidic fruits. So this can definitely slow down digestion and trigger gas and bloating. So keep your grains and your acidic fruits separate as well. Things that are good for pairing are going to be meats and cooked veggies. Those are going to promote stomach acid, better protein breakdown, starchy veggies and healthy fats. Think like sweet potatoes and olive oil. Obviously, we've talked about oxalates. Try and limit those when you can as you're trying to reintroduce those into your body, rotate around them. So I wouldn't recommend having sweet potatoes every single day or some of these high oxalate foods every single day. If you are and you feel great, perfect. I would just monitor it, see obviously how your joints and your body's feeling, especially in your digestive system. But if you're somebody who's been pretty sensitive and you're reintroducing it, still keep that in mind. Other good pairings are going to be green, citrus, or vinegar. You guys can split them up as well. But basically those are going to boost nutrient absorption, especially iron. Berries and dark chocolate is another one that's great too. Both are rich in polyphenols that support gut bacteria, brain health, and oxidative defenses. So we want to improve our immune support. We want to help with our gut bacteria. We want to improve our brain health. Both dark chocolate and berries are great for that. Dark chocolate is a great nitrous oxide producer, which is going to promote better blood flow and better circulation in areas of our body. So those are kind of the pairing things that I would go with. As far as a good pro tip, I definitely wouldn't overwhelm your gut with 10 different foods at once. Keep meals simple and intentional. Amount of stress that you can put on your GI system, especially post-detox when you're trying to heal, adding all this back in at once is going to be a lot. I've said it a few times in here, but you want to reduce the stress on your microbiome and allow for better nutrient uptake. So don't overwhelm your body system all at once. Be smart about it, which is why I want to give you these tools. The next phase is going to be water, minerals, and rehydration. So filtered water is a non-negotiable. Make sure that you're getting your water completely filtered, get a reverse osmosis system, get fluoride out of your water, get these toxic chemicals like chlorine, PFAS, and other heavy metals out of your water, or you can even use like a carbon block filter and avoid plastic bottles as much as possible. A lot of those are going to leach those chemicals directly into your water, especially if they're not temperature controlled. But a reverse osmosis water system is basically going to remove everything. And so to add it back, there are add back systems. There's things that in the reverse osmosis industry don't destroy minerals as much. They don't take out minerals as much as they're filtering your water. Or you can get an add back system where they add specific minerals back into your water. What I really like, because sometimes it's hard, especially I'm on the go 24/7. So I try and get my number one focus is getting my water as clean as possible. And then I use Baja Gold sea salt. So basically just a pinch of that to replenish, especially with it containing over 90 trace minerals. It's going to support your adrenals, your nerve function, and really hydrate at the cellular level. So your body holds on to a lot of these nutrients, which is important, and these minerals. So, and then I've talked about it before, but as far as water intake, most adults need to be consuming at least a gallon a day. So I try and aim, especially since I'm living at high elevation and I'm a pretty active person. I'm working out at least an hour every single day and on my feet a lot on the go. So I'm consuming it about an ounce per pound of body weight. So I'm obviously over the typical gallon threshold. A lot of people are. A lot of adults are consuming anywhere from 1 to 2 gallons a day. So I would aim for a minimum of a gallon, which isn't hard to hit, morning all the way until evening as you go to bed. Keep your body hydrated. Obviously, you want to keep your urine at a nice kind of light yellow color. And, adding that back in, especially with some Baja Gold sea salt to keep that sodium level up, is going to be important so you don't flush out all your electrolytes in the process of increasing your water intake. Electrolytes are important, especially you're going to be sweating them out. So post-detox supplements, I've gotten a lot of questions about this too. So what are some supplements that I can take after my detox that are going to obviously promote my body's immune system? They're going to help me feel better, support my GI system. So raw liver is a really good one. I love capsulated or freeze-dried raw liver capsules. That's basically nature's multivitamin. And so they're going to contain really good levels of B12, vitamin A, copper, iron. So it's some of the most nutrient-packed kind of sources that you can get. So same thing, if you're looking for, a good supplement, you're somebody who's not, you're somebody who's not getting a lot of red meats in their diet, you're not getting a lot of nutrient-packed meats in your diet, I would consume a raw liver supplement, which is one of the easiest ways to get a really nice profile of those vitamins that you would normally get through red meats. Magnesium glycinate is another fantastic supplement. So magnesium glycinate is going to calm your nervous system. It's going to improve your digestion. We see that water follows magnesium, so it's a fantastic supplement. If you've noticed that you're more regular in your bowel movements, you're trying to promote better digestion and be more regular. So it's great to take in the evenings. Make sure that you take plenty of water with it when you do take magnesium. Any kind of magnesium supplement is great for digestion. If you're somebody who's trying to take magnesium more for inflammation and better blood flow, it is going to help with that. A lot of times it's going to primarily work in your GI system. Some great options though are IV magnesium. So there's a lot of IV clinics that offer an IV or an intravenous form of magnesium that goes right through your veins, as well as injections. So both of those are great alternative forms of magnesium that I've seen a little bit more affinity and benefits for an inflammation perspective, but another option to add into your routine. We've talked about the methylated B vitamins, but methylfolate, methylcobalamin are really going to be important for proper methylation. Glutathione and acetylcysteine. So glutathione is a master antioxidant. Acetylcysteine or NAC is the precursor to that antioxidant. Both are produced in the liver. Both are fantastic for detoxing and healing the liver and our kidneys. They are critical for cellular repair and toxin elimination. Acetylcysteine we give in the hospital a lot. It was normally known as Mucimus, which was fantastic at flushing out the liver after a Tylenol overdose. So it's very good at eliminating a lot of those toxins that can develop inside of our liver. It converts to glutathione, which is that master antioxidant. It's fantastic from an anti-aging perspective for our cells. It works to modulate a lot of the cellular damage that can occur inside of our body, especially at the skin level. So it's really great for fine lines, wrinkles, age spots, things like that. So I personally love glutathione. I think it's a fantastic supplement. We've had a lot of patients that are also going through chemo and radiation. They speak with their oncologist. They start noticing that they have a little bit of an increase in their liver enzymes. They want to keep those under control. And they're also looking for something to boost their immune system and keep them kind of healthy while they go through this process. So we've seen a lot of oncologists promote that. And they'd come in and they would get anywhere from 1,000 to 2,000 milligrams of IV glutathione on a consistent basis about every 2 to 4 weeks. And see a significant benefit in their liver profile. I do recommend it if you're noticing you have a fatty liver, you have high liver enzymes. Acetylcysteine and glutathione are fantastic. If you're looking for somebody who's maybe looking to detox their liver, these are fantastic supplements. So even when we talk about in the beginning of the protocol for opening up our detox pathways, glutathione and acetylcysteine are great supplements to open those up, start detoxing our body and get kind of that some of those things out of our liver as well. Omega-3s are another smart supplement to add into post-detox as well. So they're very anti-inflammatory. They support your skin, support your brain, support your hormones. So opt into omega-3s. That's something that I would go towards over any other omega list. So add omega-3s to your profile. They're also fantastic. A lot of times we don't get enough healthy fats in our diet. If you are somebody that, like myself, just typically runs on a little bit of a lower fat diet and you feel better that way, I love taking an omega-3 supplement. I feel like it's great for my brain. It helps significantly. If you are a man as well that's on testosterone replacement therapy, and let's say that you've noticed that you've started having a little bit of an increase in aromatase and you're developing a higher estrogen level, a lot of times your doctor is going to increase your aromatase inhibitor, your estrogen blocker. And a lot of times those can decrease your cholesterol levels. So a healthy omega-3 supplement is going to be very important to maintain healthy cholesterol in your body as well. So omega-3s, I love omega-3s. Take a look at those, especially as you're going through this detox process. I think a lot of people are wondering, what are good supplements, what are bad supplements. I do have some recommendations in the bio of my Instagram. There's a link in there. There's some great ones for detox. I can tell you as well, there's a lot of really good reputable brands out there. Just do some research and you can kind of start dialing in some of the supplements that you have. So I really like Global Healing. That's one of the ones that I think I found a lot of really great benefits in. ProMix is another really great company. I try and find ones that are really well sourced, ones that are going to be a little bit more closer to the organic side, aren't going to have any kind of fillers or added things that I don't want inside of my body as well. So a couple good brands for you guys to kind of check out. As far as the next phase, I really talk about, folic acid and the problem with folic acid. I don't know if people have started listening to this or not, but folic acid is not the best supplement to be taking. So most enriched or fortified grains are going to be sprayed with a synthetic folic acid. That's why a lot of people will notice that they have a lot of issues digesting these types of grains. They go to Italy and they have pasta and breads and all this stuff over there and they feel amazing. But here they feel horrible. And it's because literally all of our grains that say enriched or fortified are going to be sprayed with that synthetic form of folic acid. And over 40% of people have developed what's called the MTHFR gene mutation, which is making them unable to convert folic acid into the active form, which is methylfolate. And that leads to neurological issues, hormone imbalances, infertility. So stick with methylated B vitamins. Eat food that are rich in real folate, like avocados, lentils, leafy greens, things like that. So as far as the MTHFR gene mutation is concerned, it inhibits our body from converting folic acid, which is vitamin B9, into methylfolate. We have to have those active forms. They have to be methylated in our body to be able to use them. So giving them something that's already methylated, already active, allows our body just to take it and use it up very, very quickly. And if you have this gene mutation and you're taking these vitamins, you're taking unmethylated B vitamins, your body's using up more and more methylation stores, you're going to get worse and worse. You're going to feel worse and worse. So I highly recommend, if you are wondering if you have this gene mutation, you want to get a test done, definitely go and get it looked at, check and see if you have this. Like I said, over 40% of people have this gene mutation. It's very common. So even if you don't get a genetic test, it's great. If you are feeling like this could be something that you fit into that mix with, I would definitely just opt into methylated vitamins, and you're going to start noticing you're already going to start feeling better. Whether you have this gene mutation or not, taking something that's already in the active form is going to help you feel better and start to give you those added benefits right off the bat. Now, one of the other ones that's quite curious that I always talk about that ties directly into the MTHFR gene mutation is POTS. And so POTS, a postural orthostatic tachycardia syndrome, very common in very young women. Basically, it's an inability for your body to compensate with orthostatic changes. So from a seated position to a standing position, if you're really active, a lot of these women have a very active vagus nerve, which is responsible for driving down heart rate and blood pressure. That's right in our runs right in the middle of our neck here. And so we see vasovagal responses, or syncope, is very common in these women. They're also typically B vitamin deficient, and they usually have the MTHFR gene mutation. A lot of it can also be hormonal too. We do see a lot of women that have POTS. It corrects after they have their first baby. So there is that interesting hormonal component of it, but it's typically very young women, very active young women that develop this. So active B vitamins are going to be very important for these women. I would stay away from any forms of high levels of magnesium or anything that's going to basically cause any kind of like vasodilation or relaxation of your blood vessels and your smooth muscle. Magnesium, when we look at certain amino acids like arginine, things that are promoting better blood flow, I would try and limit those, and I would increase your sodium intake. So increase that salt, take an eighth to a quarter of a teaspoon of salt, increased every day. Drink more water. So replenish those electrolytes more often, and you're going to start noticing you're feeling better. The B vitamin component is huge. A lot of the people that are dealing with the MTHFR gene mutation and are dealing with POTS, they go hand in hand. They will wake up in the morning and they feel like they can go directly right back to sleep. They feel just chronically exhausted. They don't get enough sleep. And it's not so much of a hormonal issue when we look at women that are menopausal or perimenopausal and they're dealing with similar symptoms. It's more so of the inability for their body to process these vital nutrients, using up methylation stores, and then obviously having a very overactive vagus nerve. If you have POTS, IV clinics are great for anybody that has POTS. I can tell you there's a lot of fantastic benefit to getting a once a month, twice a month IV, just keeping those levels of fluid and electrolytes up in your body, especially if you're a high performer or you're an athlete and you obviously don't have a lot of time to be dealing with stuff like that. It's something to definitely investigate in and look closer at. So now, as we start really diving into rebuilding our gut flora. There are very important bacteria that we want to introduce into our GI system. So, we've talked a lot about how we have started to clear out pathogens, and now it is time to really reseed and refocus on beneficial strains of bacteria that we put back into our body. So, some of the four most important bacteria, which we'll really go into, we're going to talk about some of those. There's a doctor by the name of Dr. William Lee. He is a foremost expert in all of this bacteria, especially when we start looking at cancer and fighting cancer, especially when we look at basically taking our body and putting it in a position to heal from a immune perspective and promoting better gut microbiome in our body. He is a fantastic person to listen to. I highly recommend listening to him, but he speaks a lot on this bacteria. So when we look at something like Lactobacillus rhamnosus, there is a important reason for this. Basically, why does it matter? It's promoting recovery from antibiotics and gut detox antimicrobials. So when we talk about cleaning out our GI system, we talk about using things like oregano oil, black walnut. When we look at things like wormwood and clove, fulvic acid, some of the things that are really going to take a scrubbing action and detox and pull out parasites and a lot of heavy metals. When we look at chelators, a lot of times that they can have a harsh time on our GI system and they can push out a lot of that good bacteria as well. So you really want to get the right kind of bacteria back in. The one that I mentioned is great for supporting mental health. It's really important for improving mood, reducing anxiety. It helps with immune modulation and rebuilding intestinal barriers. And it's also shown to basically reduce inflammation in IBS and IBD patients. So having the right kind of gut bacteria, if you have IBS, Crohn's, if you have a lot of GI inflammation, obviously that's why we're doing this detox, is where we're flushing things out. Now it's time to rebuild. So this bacteria you can find a lot in clinical grade probiotic blends. It's also in fermented dairy and some really high quality yogurt. And it works really synergistically with fiber rich foods as well. So great bacteria there. Lactobacillus reuteri is the next one. It's fantastic for oxytocin, skin, and hormone health. This one matters because it's specifically producing oxytocin, bonding, calmness, and even lean muscle growth. It supports your skin health, it reduces inflammation, and improves immune function, and it can also improve testosterone levels in men and gut integrity in women. So there's a really great benefit when it comes to Lactobacillus reuteri. It is Dr. William Lee's kind of top one on his list for pro longevity strains. So they look at the benefits of this bacteria and how it's directly linked to longevity, particularly for its ability to activate youth promoting pathways and reduce stress-induced inflammation. Especially from a cellular level, we want to reduce as much stress and strain on our cells as possible, especially if you're looking at the direct links from cells to disease. Reactive oxygen species is an important one, or oxidative stress is one of those things that we want to try and reduce as much as possible. So you can get this one actually in properly fermented sourdough as well, some strains of kefir, and you can also get it if you're looking for L. reuteri supplements as well. It'll say it on the back. So Lactobacillus reuteri is a fantastic bacteria to make sure that you do kind of get back into your system. The strain of Bifidobacterium longum is very important for calming the gut and brain axis. When we talk more about mental health, when we talk about mood, there is a direct link between our GI system and our gut microbiome and our brain, especially our serotonin receptors. So that gut-brain axis is a real thing. It's very important. So we want to support that. We also want to support digestion of complex carbs. It also is going to help modulate our immune response and reduce GI inflammation. It's great for improving absorption of different minerals and the production of short-chain fatty acids. Best ways to get this are going to be found in different kind of probiotic blends. It's also found in breast milk and kind of early colonizers of the gut. And then pre and probiotics, like if you look at prebiotics like acacia fiber, oats, resistant starches that support its growth, they are present in there as well. So nice benefit there as far as a kind of a third top bacteria that you can introduce into your body. So, all right. And then the next one that we'll talk about, Akkermansia, is basically for gut lining and longevity as well. So a very important strain of probiotics. It's important for protecting and strengthening the gut lining, especially crucially after detox. We'll talk about why in a second. It's linked to weight control, blood sugar stability, anti-aging. It helps reduce leaky gut and inflammation. So this form of bacteria is very important. Dr. William Lee really talks about how Akkermansia is one of the most promising bacteria for extending lifespan, supporting metabolism, staying healthy and reversing obesity-related dysfunction as well. So research Dr. Lee, look at Akkermansia. Basically, how do you feed it? It is, essentially prebiotics like pomegranate, cranberry, green tea, and other polyphenol-rich foods are going to help with it. Resistant starch and fasting also increases activity. So fasting is a great thing to add into this. When we talk more about it, nutrition, we'll talk about the importance of fasting, and then certain select probiotics will have it as well. But using fermented foods like kefir, sauerkraut, sourdough, apple cider vinegar is really going to support recolonization of a lot of these. Skip ultra-processed, fat-free yogurts. A lot of them contain emulsifiers like carrageenan and polysorbate 80, which can really damage the gut lining. A lot of times, if you ever had a all organic, non-processed yogurt that's just plain, a lot of times it basically falls apart. So a lot of companies will add these emulsifiers like carrageenan and polysorbate 80, which can really cause a lot of inflammation in your gut, and to give it that thickening and that taste and basically get it to hold up. I can tell you Siggy's yogurt is a fantastic one. You can get their fat-free plain Greek yogurt, and it is a company that does not have emulsifiers or sweeteners in it. So then it doesn't hit that kind of that processed or ultra processed mark. Real long fermented sourdough is great to have in your diet. Apple cider vinegar with mother is the important component when you're looking for apple cider vinegar products. And then there's also prebiotic fibers too. You can get it in green bananas and cool potatoes or rice. A lot of other things that you can get. Important thing, I've gotten this question a lot. A lot of people have asked, okay, so how many in billions of CFUs should I be taking as far as probiotics are concerned? So CFUs, I get the question a lot too. What are CFUs? So colony forming units basically are referring to the number of viable bacteria or microbes in a probiotic that are capable of replicating and forming colonies in your gut. It's basically the standard way of measuring potency in probiotics as a CFU. Now, common CFU ranges, we see low doses anywhere between 1 to 5 billion CFUs, moderate doses between 10 to 30 billion CFUs, high dose 50 to 100 billion CFUs, and then clinical strength, which is really usually often refrigerated or practitioner grade, is 200 plus billion CFUs. For most people, if you're going through gut cleanse, chelation, you're going through, any kind of a parasite cleanse, it's very important to increase your probiotic count to protect that gut bacteria, keep your gut healthy. That should be anything between 20 or 30 to 50 billion CFUs of those probiotics. When you come back off of those and you're tapering off of those parasite cleanses, those chelators, those detoxifiers, that is where you can start going more into a lower or maintenance phase, which is going to be more between that 5 to 10 billion CFU range. 10 to 20 billion, like I said, is pretty common when you're taking any kind of detox antimicrobials, which is going to be things like oregano oil, black walnut hull, wormwood, clove, fulvic acid, even berberine, which I kind of talked about all these earlier, but those are going to have that scrubbing action, which is going to work through our GI system, and it can also work on several different forms of bacteria. It's good because we want to clean up our gut. We want to get a lot of this stuff out of our GI system, but we obviously want to protect our body as much as possible and make it easier for us to do what we're talking about now, which is replenishing everything back into our GI system. The CFU count is usually listed at time of manufacture. It doesn't always check for how long it will maintain that CFU in through time of expiration. If you're looking at probiotics, you're looking at CFUs, you're trying to find ones that have the right range for what you're going for, make sure that the brands guarantee CFU at time of expiration, because a lot of times they are only counting CFUs at the time of manufacture. So you want to make sure that you're getting those strains maintained all the way up until the expiration date on that bottle. And so you're not taking something that's not active and giving you what you need as far as probiotics are concerned. And higher CFU isn't always better. So strain diversity and survivability matter just as much. So you want to make sure that those are going to survive for long periods of time. They have diverse strains of probiotics. And then you also want to be careful too. If you start noticing you're taking high levels of probiotics and you start getting a lot of really bad flatulence and bloating and really bad burps, that's signs that you're getting some intestinal bacterial overgrowth, things like SIBO. Those are times to back off of those probiotics. And if you've been taking probiotics and you haven't gotten gone through a GI cleanse. Some of these things we talked about in the last episode, as far as detoxifiers, are great to maintain a healthy candida balance and get your bacterial overgrowth down. So go through that. If you're listening to this podcast and you're already on high levels of probiotics and you're like, my GI system really doesn't feel good, I would taper those down, see how you feel. I would opt into doing a GI detox and taking some of these antimicrobials to flush out some of that bacteria, heal your GI system, get anything bad that's in there out, and then obviously then start your probiotics again and kind of repopulate those at higher levels. So, and then antioxidants are next. So antioxidants are really when now it's time to add these back in to boost your immune system. Some of the post-detox oxidants that are going to be the best for your body are going to be things like glutathione and vitamin C, which are glutathione's a master antioxidants. We talked about that. Vitamin C is very important for immune and skin support. Vitamin C is great for collagen production. It is fantastic when we look at immune support. There's a lot of really, really good research out there regarding vitamin C's benefits on cancer and our body's ability to take vitamin C, convert it into hydrogen peroxide, and specifically use it to attack cancer cells, which we will get into another episode. If you hear that or you hear anything on this podcast and you are interested and you want to know more about it before we've talked about it in another episode, please reach out to me directly. Send me a DM on Instagram. Happy to talk with you about it. Vitamin E as well is really important for cellular repair. Vitamin E, vitamin C, glutathione, these all go together and they work synergistically with CoQ10, which is another really important one, and NAD. So in our body's recycling process, especially for recycling NAD, which is important for healing our cells, improving our mitochondria, it's directly linked to our body's ability as far as anti-aging and neurocognitive function. These vitamins are all very important for that as well. So if you want to live a very healthy, long life, glutathione, vitamin C, vitamin E, CoQ10, and NAD are the antioxidants you should be consuming. And then curcumin and sulforaphane are anti-inflammatory and detox activators. So, and there's a lot of really good research behind curcumin and its benefits specifically on the brain, on neurocognitive function. When we speak a little bit more about it, we look at curcumin and resveratrol. There's a lot of great benefits as far as cognitive health on reducing, basically promoting better neurotransmitters and elevating our body's ability to access higher level thinking. So really interesting stuff there. I can tell you that acetylcholinesterase is something that breaks down acetylcholine in our brain. Acetylcholinesterase is something we want to limit, so that way acetylcholine can promote and we can have higher levels of thinking. So curcumin and resveratrol are fantastic for that. So they're great for when it comes to Alzheimer's. Alzheimer's drugs do exactly the same thing. So if you're wondering what are great alternatives as far as promoting better reduction in Alzheimer's development, curcumin and resveratrol are fantastic for that because they're working on a lot of the same pathways on reducing acetylcholinesterase and promoting higher levels of acetylcholine in our body. Next ones, CoQ10. Spoke on that just a second ago. Fantastic when it comes to mitochondrial energy and brain health. Be careful with CoQ10. If you're on blood thinners, CoQ10 does have the affinity to reduce blood thinners. So any supplements, of course, do your research, consult with your healthcare provider, make sure that you obviously have a good understanding of what they do and their interactions before taking them. But CoQ10 is fantastic, especially for your heart. It's very protective over myocardial tissue. And then there's also a lot of other great immune support that can come from garlic and ginger. Obviously, we talked about being careful with introducing some of those back in, especially onions, hydration and minerals, sunlight or red light therapy. And then sleep is a huge one. We talked about sleep last time in the detox protocol, but 8 to 9 hours of sleep per night is very, very important for your brain. We see there is a lot of impacts on people that are getting 5 or 6 hours a night or less of sleep on a consistent basis, directly when we look at things like fertility and aging. So that speeds up a lot of poor metabolic processes in our body. And so sleep is a very, very important component for us. And then final one is really breath work and movement. This is kind of the last thing that you should really make sure that you've already implemented or have it into your phase, which is basically walking, stretching, doing breath work. Our body heals in a parasympathetic state. And that is very important for anybody that's even a very avid exerciser, or anybody that's lifting weights. If you're a bodybuilder, CrossFitter, runner, cyclist, whatever it is, our body has to hit a parasympathetic state to heal. So if we are constantly in a fight or flight state, which is our sympathetic nervous system, where our adrenals are pumping out, epinephrine's getting dumped, we're not going to be able to heal. We're not going to be able to recover. Our body's going to have a very difficult time, not even just when it comes to muscle growth and recovery and detox. We're looking at higher levels of cortisol, further strain on our adrenal levels, leading to adrenal fatigue. So I do tell you, we want to get your body into a level of parasympathetic parasympathetic nervous system states. This is very, very important when it comes to trying to get your body to calm, to relax, to heal, to sleep very well. So your body needs time to essentially reset. If you're constantly going and going and going and you're taxing your central nervous system, which is why people develop, as far as issues with their adrenal levels are concerned or any kind of adrenal fatigue, it comes down to our body's inability to access a parasympathetic state and calm ourselves down. So I would, obviously add in strength training sessions 2 to 3 times a week as well. During your detox or after your detox ends, that's going to be really important as well to help your body to decompress and get out of a sympathetic state and back into a parasympathetic state. And then prioritize sleep. Your mitochondria, your brain, and your immune system regenerate during rest. So make sure that you're getting adequate levels of sleep. I've spoke about some of the top sleep supplements before too, but ashwagandha is a fantastic sleep supplement. There's several different forms of magnesium glycinate, magnesium threonate. Those are fantastic for your sleep. Vitamin D is very, very important for your sleep. I talked about this in the last episode too, but if you are vitamin D deficient, your body's going to have a very difficult time converting and producing serotonin and melatonin in the brain, healthy mood and healthy sleep levels. A lot of people that have low vitamin D levels have insomnia and depression, so an inability to sleep through the night and poor mood levels. So I highly recommend getting your vitamin D tested. Take a look at it. I do weekly vitamin D injections, 50,000 IUs a week. My vitamin D was very low. I feel so much better. I'm getting very good sleep now. My mood's at an elevated level. So look at vitamin D supplements. I wouldn't take more than 5,000 IUs of oral vitamin D per day. It's hard to get your really low vitamin D levels up from a low vitamin D intake. You can make yourself really sick taking high levels of oral vitamin D. So I would recommend going and getting injections. You're going to get far more out of it. It's going to really adequately raise your vitamin D levels far better. If you're very fair skinned, if you have red hair, even blonde hair, if you're not out in the sun a lot, if you're somebody that burns really easy, these are all kind of signs that you could have some pretty low vitamin D levels. Naturally, people are getting lower and lower vitamin D levels because we're just not outside. We're not getting enough sunlight. If you're working overnight shifts, your sleep cycle's already going to be messed up. Your vitamin D is probably really going to be low, which impacts hormones and things like that too. But you can only do so much. Get a vitamin D lab test done. Anything less than 30 is going to be considered pretty low. If you're lower than 30 as far as the vitamin D level is concerned, that's usually where you want to go in and start getting vitamin D injections or, taking a higher level supplement with it. So, and then get your sunlight. Make sure you're getting plenty of sunlight. So as far as final thoughts on this, first of all, I want to thank you all for joining me. I think it is fantastic getting to speak with you all, educate you all, give you all, I think, more and more information as time continues and guide you through this. There has already been a lot of requests on topic to speak about, which is fantastic. I love it. Please, if there's certain things that you want to listen to, comment on the posts, reach out, DM me directly. If there are things that you want to hear more about specifically regarding your own circumstances, please reach out to me. I'm happy to speak with you all and give you kind of the insights that I possess. I'm also happy to set up on a one-on-one kind of ongoing system with you and kind of guide you through this detox process and rebuilding your health. So if that interests you, you're curious, you feel like you're somebody who needs some help and some assistance, please don't hesitate to reach out. And I'm happy to help where I can. Detox is one of those things that's going to, I think, open up a lot of benefits for a lot of people. Detox is also something that has cleared the battlefield. And so now it's time to build a fortress, right? We want to get our body back up as strong and as healthy as we can. So rebuilding your gut, your hormones, and energy is really how you lock in the grains from detox and take those nuggets and kind of build your health into a better spot and ultimately into long-term health, right? Like we want to live as long as healthy as we can and live the fullest life that we can. So all of this comes into it. I recommend doing a detox protocol and going through a rebuilding process twice a year. This is something that is kind of can be reduced and taken to your specific case. Some people need a very in-depth, very thorough form and approach when it comes to detox and rebuilding, especially when we look at autoimmune issues, when we look at high levels of inflammation in the body. Once you've reset, you've gotten your body on point, a lot of these are much easier. Doing them 2 or 4 times a year where you're just trying to do routine maintenance, clean out anything poor, get your body's gut microbiome and inflammation kind of under control once again, reset. So take it Obviously, from the perspective of somebody who's done it, I personally have seen drastic changes in my own health, in the health of people around me that I've counseled and that I've worked with and that I've been able to help with this. So these protocols work. They're fantastic. They do require a little bit of an individualized approach. So research, kind of guide yourself through it, and find somebody else to guide you through it as well. Someone that you can trust that specializes in a lot of these things, and gather a lot of opinions. Right? Like your health is far too important to outsource to someone else entirely. I think a lot of times we think it's not okay for us to have an opinion on something if we're not a doctor, or society very easily makes us feel like we have to have an MD to be able to have an opinion on our health. And there's people just like myself, just like you or anyone out there that I'm sure is listening, that wants to have an opinion, that wants to be able to grow and keep their children healthy, keep themselves healthy, keep those around them healthy. And there is a lot of misinformation. There's a lot of unfortunate direction that there shouldn't be, that forces, kind of mainstream and Western medicine practices, and unfortunately demonizes a lot of the stuff that we talk about here. But we're seeing a huge awakening in and around health. Your health should be your priority. Your health is ultimately your responsibility. So I implore you, as always, to do some research, gather opinions, and don't listen to all the people that don't necessarily have the same mindset. I have seen the connection between emergency and mainstream medical practices, and I've been in and around acute care and emergency medicine for a long time, and then I've been in the integrative and alternative and holistic health spaces for a significant amount of time now, and they work. And so if you are feeling alone, or like you're not allowed to have an opinion in society, or like you're being shot down in a lot, there are like-minded people just like you, and I'm here to educate and guide and hopefully give you the resources that you need to guide your own health, to live a healthy life. So once again, let's rebuild right, because detoxing is not the end. It is your new beginning. Once again, thank you all for tuning in. Thank you all for listening to me. I am sending out tons of gratitude and love, and I appreciate you all. And I'm a resource. So I'll talk to you all again next week. Thank you so much for tuning in. Thank you for tuning into the Vitalis podcast. If you found value in today's episode, we'd be so grateful if you'd leave us a rating and a review. It truly helps us grow. Share this episode with friends and family who are also on a journey towards deeper health and truth. And stay up to date with weekly episodes. Be sure to subscribe on Apple Podcasts or Spotify, and follow us on Instagram at the Vitalis Podcast. Please remember, the content shared on this show is for educational and informational purposes only. It is not a substitute for personalized medical or mental health advice, nor does it establish a provider-patient relationship. Always consult with your physician or qualified healthcare professional before making changes to your health protocols.